今日就要嚟講翻我 miss 咗嗰四堂 lecture 啊，我睇翻個記錄好似係Code of Ethics 啊、Model of Health 啦、Concept of Health 啦，我係 miss 咗呢幾堂 lecture 嘅。咁左邊就係我自己温書嗰啲筆記啦，右邊就係個 lecture notes 啦。咁我就主要係講翻我 drop 低咗佢重點去講翻呢堂 lecture 嘅。咁首先係呢個 Code of Ethics 啊。咁裡面第一個重點就係呢個 Code of Conduct，就係 employer must support staff in adhering to the code, preserving public trust in nursing quality and safety. Educator use the code to teach students the impact of ethical standards on their future roles 啊，就係呢個簡單嚟講，呢個就係護士要遵守嘅護士倫理嗰啲守則啦。咁呢個就係 framework of the code 啦。裏邊有五個 domain 啦，第一就係 respect 啦，第二就係 research merit and integrity 啦，第三係 justice 啦，第四就係呢個 non-maleficence，佢仲有 beneficence。咁入邊就要包括呢個 honouring patient dignity and autonomy 啦，即係尊重翻個病人個自主權啦，同埋佢哋嘅尊嚴啦。咁 ensuring scientific rigor and honesty 啦。跟住 fair equitable treatment for all 啦，avoiding harm 啦，acting to promote patient well-being 啦，跟住就係11個 ethical standards 同埋 ethical responsibility 咧。咁 primary 嘅 ethical principle 就包括呢個 beneficence， 高就係要 promote 呢個 the patient's best interest， 即係為個病人好啦。Required to assess what constitutes as good for the patient. Nurses are legally and morally obligated to act beneficially. 跟住第二就係 non-maleficence，即係 involves in preventing deliberate or accidental harm, minimizing risks, avoiding unnecessary procedures, and adhering to safety standards. 第三就係呢個 autonomy 啦，nurse must facilitate informed consent, ensuring patients understand risks, benefits, and alternatives. Respect extends to cultural, spiritual, and personal values. 我記得考試係考過呢題，跟住justice, care must be impartial and unbiased. No discrimination based on race, gender, religion, or socio-economic status. And allocation of scarce resources must follow the fair criteria。咁呢個就係個 secondary ethical principle 啦。第一個就係 truth-telling 啦，咩 veracity 咧，即係 underpins all interaction。Deception erodes professional credibility，即係要無時無刻都係誠實咁樣交流啦。Fidelity keeping promises obligates nurses to honor commitments, reinforcing reliability。跟住仲有呢個confidentiality 嘅 privacy protection，is protected by old promises and today's rules。breaking it can risk patients and damage trust。咁接下來就係呢兩個嘅 ethical theory 啦。第一個係 utilitarianism 啦。簡單嚟講，呢個就係 emphasize what yield the most overall 嘅啦，即係以大數犧牲少數。act utilitarianism 就係 choose actions that maximize overall utility in each situation 啦。咁 rule utilitarianism 咧就係 adopt rules that what generally followed produce maximal welfare。即係話簡單嚟講都係如果一兩個人嘅利益可以俾人犧牲去保存大家嘅利益嘅話，就會犧牲嗰一兩個人嘅利益。跟住就係呢個Kantianism 啦。簡單嚟講就係emphasize moral duties 同埋 rights，仲有 responsibilities 啊。就係doing what's morally right because it's the right thing to do, no matter what the consequences are. Telling the truth even it may cause discomfort，即係根據呢個道德去做所有嘢，唔理佢後果係點啦。咁第三就係呢個fertile ethics，就係 character focused moral theory 啊。咁就係value triads such as honesty, courage, and justice to live a good life rather than focusing on rules。咁裏邊嘅 category，咁呢課嘅 category 咧，principles 就包括 beneficence 啦、non-maleficence 啦、autonomy 啦、justice 啦。咁 secondary 嘅 principles 就包括 veracity 啦、fidelity 啦、confidentiality。咁primary focus 係 direct patient outcomes and fairness 啦。咁 secondary 個 focus 係 trust、honesty 同埋 privacy 啦。咁primary typical application 咧就係呢個 clinical decision making 啦、resource allocation 啦。咁 secondary principles 嘅 typical application 就係 communication 啦、documentation 啦，同埋 legal compliance。咁入邊個 utilitarianism 同埋呢個 deontology 即係呢個 Kantianism 咧。咁個 core question 就係what action yield the most overall good 啦。就係呢個 utilitarianism 咧就主要係 focus 落乜嘢係令到大家個利益最大化。咁呢個 Kantianism 咧就係 focus 有冇做到自己嘅道德責任，即係有冇盡到自己嘅道德責任啦。咁個 decision process 咧，呢個 utilitarianism 咧就係先計算下個後果係咩先，跟住就揀令到大家最好嗰個方法。咁呢個 Kantianism 咧就係首先係揾到呢個道德嘅規則啦，跟住就根據呢個道德嘅規則去做嘢啦。唔理個後果係點樣，即係最大個分別就係一個係計算咗後果先去做嘢，一個就係根據呢個道德去辦事。咁有咩好處咧？呢個 utilitarianism 咧就應該係比較 flexible 嘅，跟住而且都係比較適用於喺呢個咁複雜啊呢個咁複雜嘅世界啦。跟住就對呢個公共醫療都好有用嘅。咁Kantianism 就比較唔適合啦，因為雖然佢有好清楚、好 consistent 嘅 guidance 啦，但係我就覺得佢比較唔適用於呢個現實嘅世界嘅。佢亦都有保護到少數族裔嘅權益啊，同埋佢係 aligns with professional codes 嘅。咁個 utilitarianism 個 limitation 就係 may justify actions that harm individuals if they increase total benefit, difficulty to quantity utility。咁Kantianism 就係比較 rigid 啦，may ignore consequential harms, potential conflict when duties clash。咁呢個就係 application in healthcare context 啦。resource allocation 呢個就係例子嚟嘅。utilitarian lens prioritize intervention that save the most lives，就係例如呢個係呼吸器咧，即係呼吸器嗰個分配啦。咁呢個就係 Kantianism lens respect each patient's right to fair treatment, avoiding discrimination even if it reduces overall survival。咁個 vaccination policy 都適用於呢兩個ethical theory。第一就係 utilitarian 啦，promote mass immunization to achieve herd immunity, maximizing community health。咁呢個 Kantianism 咧就係 uphold informed consent and individual autonomy, ensuring no one is coerced。咁 end of life decision 啦，utilitarianism 咧就 consider overall suffering reduction, may support withdrawing life-sustaining treatment when benefits are minimal。就話睇下佢醫唔醫到，如果醫唔到嘅話就唔會繼續醫。咁 Kantianism 就 follow the duty to preserve life and respect the patient's autonomous wishes, even if the outcome is less optimal for the majority。就唔理醫唔醫到啦，都會根據翻個道德規則、道德守則去醫佢先。即使未必醫到。咁個 key takeaway 咧就係 ethical dilemmas in nursing often require balancing this perspective. The code of ethics incorporates both It mandates beneficence, while also demanding respect of autonomy and fatality。咁大概係總結完呢課，咁之後就係呢個 model of health 啦。model of 咁就有分為theory 同埋 non-theory 啦。咁講住呢個model of health one。咁點為之一個好嘅 theory 咧？就係呢個根據呢個 Foucault six criteria for concept。咁第一個就係呢個significance 啦。咁就包括 addressing nursing meta paradigm 啊，contributes meaningfully to nursing knowledge 啊。咁仲有呢個 testability 啊。咁就係個 hypothesis 係咪 testable 啦，concepts 同埋 preposition 係 observable 啦。咁仲有呢個 internal consistency 啦，所有嘅 concept、preposition、definition 係 congruent to each other 啦，即係唔會有任何嘅重疊衝突啦。咁仲有呢個 empirical consistency 啦，咁就包括有足夠嘅 research finding 去 support 啦，即係 evidence-based 嘅theory 啊，跟住仲有 align with empirical evidence。咁仲有呢個 parsimony 啊。status in the simplest way possible 啦，without oversimplifying 啊，即係以最簡單嘅方式去呈現出嚟啦，又唔會過度去簡單化。咁仲有呢個 pragmatic adequacy 啊，applicable to nursing practice。咁點解要有 nursing theory 啊？咁首先啦，佢就確保咗 nursing 係一個 professional autonomy 啊，有呢個 distinct profession with its own knowledge base 啊，即係 nursing 呢個 profession 有佢自己嘅 knowledge base 啊。咁仲有去 improve 呢個 patient care 啦，呢個 systematic framework for understanding needs, guiding interventions and evaluating outcomes。即係簡單嚟講theory 就 guide 咗我哋去點樣intervene 同埋evaluate 個 patient 嘅 outcome。咁仲有 research foundation 啦，確保我哋所有嘅即係佢 provide 咗一個 conceptual basis for systematic investigation and evidence-based practice。咁仲有communication 啦，咁佢就 supplies 咗 a common language for collaboration among nurses and other profession。咁仲有 knowledge 啦，佢係一個 structure 同埋 organized knowledge。咁仲有 clinical decision making 啦，佢係 guides and assessment 啦，problem identification 啦，planning and evaluation 嘅。咁一個 theory 就應該包括呢6樣嘢啦 ，concepts 啦、phenomena 啦、definition 啦、assumption 啦，仲有 preposition，仲有 domains 嘅。咁 nursing theory 就分為3個 level 啦，一個係 grand nursing theory，第二個係 middle range nursing theory，仲有第三個practice level theory 啊。咁一個 theory 嘅 development process 咧，第一步咧應該係 identifying phenomena and concept development 嘅。咁就包括呢個 systematic observation of practice 啦，仲有derive and explore relations among concepts。咁第三、第四步就應該包括呢個 preposition development and theory testing 嘅。咁就 create statements describing how concepts interact, forming logical framework 啊，仲有 conduct research to gather empirical evidence, refine the theory based on findings。咁有好多factors 會 influence nursing theory 嘅 development 啦。第一就包括 historical context 啊，needs for a distinct nursing knowledge base 啊，咁就係歷史嘅推動令到係 nursing 呢個需要一個獨特嘅 nursing 知識嘅地基啦。咁仲有呢個 philosophical influence，咁 empirical vs 一個 meaning 啦 experience 啦 shape theory reconstruction 嘅。咁就仲有呢個 disciplinary influence，咁就係 integration of other profession 啦 knowledge 啦，即係包括psychology 啦同埋 biology。咁仲有呢個 practice demands 啦，而家現實世界需要呢個 現實世界嘅需要咧，推動咗呢個理論嘅發展。咁仲有呢個 constant feedback 啊，to ensure relevance 啊。咁就講下而家嘅 challenge 啊，current challenges of nursing theory 啊。咁而家個主要有4個challenge，咁就係 capturing the complexity of nursing phenomena 啦，仲有 balancing simplicity for understandability without oversimplifying，仲有 reaching scientific evidence with practical applicability，仲有 ongoing evaluation and refinement in a rapidly changing healthcare environment 啊。咁未來嘅發展方向大約都係technology integrations 啊。Contemporary healthcare focus emphasizing mental health care, wellness, and health promotion. Developing theories targeting psychological well-being and therapeutic relationship. 咁仲有呢個 evidence-based 嘅 refinement 啦，updating theory with newest research and findings。咁仲有 interdisciplinary collaboration and strengthening partnership across profession to advance theoretical knowledge。咁個 theory critique 嘅 definition and purpose 咧就係seek 呢個 constructive evaluation，not fault finding to advance knowledge and improve practice。咁個主要呢個 theory critique 咧就係去尋找一個建設性嘅討論啦，而唔係純粹去揾佢個錯處，去進步，即係去更加 improve 呢啲 practice。咁focus 6 criteria for 呢個 theory evaluation 就包括呢個唔係咁就有 focus 6 criteria 去 for 呢個 theory evaluation 啦，仲有 Barnum's internal and external criticism framework 嘅。咁就佢就主要係 emphasize 呢個 internal evaluating clarity, logical structure, coherence of proposition。咁仲有 external 啦，finding the relevance to human experience 啊，nursing practice 啊，health concepts 啊，applicability 啊，across population。仲有呢個 feasibility。咁仲有呢個 Malleus three phase theory evaluation process 啊。咁第一就係 description 啦，identifying origins 啊，development key components and 呢個 philosophical foundation。咁仲有 analysis 啊，examine concepts 啊，definition 啊，assumption 啊，and preposition。咁仲有呢個 critique 啊，evaluate logical structure, empirical support, relevance, recommend, refinement。咁呢啲 critique theory 咧，主要都係包括呢個 concept and definition 啊，assumption 啊，preposition, testability, scope, empirical evidence, scientific base, relevance，仲有呢個 practical application 啊，addressing contemporary issues 啊，guidance for assessment 啊，intervention 同埋 feasibility。咁之後就係呢個 health model theory。咁第一就係呢個 SAMHSA 10大 guiding principle 啦，咁就包括 hope 啦，就hope 啦，即係 recovery is possible and nurture hope in every encounter。咁第二就係 person driven 啊，individual defines goals and the recovery path nurses provide support。咁仲有係 many pathways 啊。Recovery is non-linear and culturally diverse. Respect varied routes to wellness。咁仲有 holistic 啊，care addresses mind, health, spirit and community in an integrated way。咁第五就係呢個 peer support 啦。咁 peers provide belonging and valued roles, facilitate connections to peer support。咁 仲有5個係 principle centre on professional practice 啊。第一就係 relational build strong therapeutic relationships，即係同病人建立一個好嘅 therapeutic 關係啦。咁仲有第7就係呢個 culture 啦，deliver culturally competent care that honors value, tradition and belief。第8就係呢個 address trauma 啦，provide trauma-informed services that prioritize safety, choice, trust and collapse。咁第9就係呢個 strengths and responsibilities 啊，就 emphasize self-care and community involvement。咁10就係 respect, promote acceptance。respect 第10就係呢個 respect 啦，就 promote acceptance 啦，self-acceptance 啦，and a positive identity。咁呢個 nursing relevance of the recovery model 啦，首先就係呢個 empowerment 啦，shift decision-making power to patient。咁therapeutic relationship 就 emphasize partnership 啦，就病人係同 nurse 係一個合作伙伴啦，而唔係即係淨係聽個 nurse 講咩做咩。咁仲有呢個 anti-stigma 啦，即係 highlight strengths counteracting negative stereotypes 啊。stigma 就係呢個 negative stereotypes 啊，即係佢哋有嘅印象，有嘅差嘅印象啦。咁仲有 ethical practice 啊。咁簡單嚟講就係 aligns with ethical principles of beneficence, non-maleficence and justice by promoting the highest possibility quality of life。就上個 notes 上個 lecture 講到嘅個 primary principle 啦嗰啲。咁之後就講呢個 Freud 嘅 psychoanalytic model。咁簡單嚟講就係 iceberg theory of mind 啦，就人嘅就分為3個，人嘅conscious level 就分為3個啦。第一就係 conscious、preconscious 同埋 unconscious。咁第一就係 ID 啦，unconscious。咁呢個就係一個 irrational、impulsive、selfish operates on pleasure principles，即係簡單嚟講係人深處嘅慾望啦。咁個 function 就係 primitive pleasure seeking and demands instant gratification，即係佢係需要一個即時嘅滿足，同埋暫時嘅滿足。咁就解釋到所有 aggressive 啦、impulsive 啦、addictive behaviour。Patients may act on ID when ego, superego weaken。即係話呢個係解釋咗好多侵略性啦，好多即係成癮嘅行為，即係吸毒啊，可能甚至係強姦啊嗰啲咧，都係由於 ego 同埋 superego 變得差咗而引致嘅。咁仲有係呢個 ego 啦，咁仲有係一個 ego 啦。咁呢個就係 reality mediator 嚇，balance ID and superego，仲有 decision making。咁 operates on general principle 啦，rational and logical，就比較邏輯性同埋 rational。咁 the part that seeks helps and engages in treatment nurses work with the ego，即係 ego 係我哋 conscious 嘅 mind，佢就係尋找幫助嗰一 part 啦。咁仲有呢個 super ego 啦，就分為 conscious，就被分為係 conscious 同埋 unconscious level。咁佢就 represent 咗我哋 internalize 嘅 morals、values and social rules 啊，operating on the morality principle。咁就係我哋嘅 guilt-inducing、judgmental、perfectionistic 嘅 source of self-criticism、guilt and shame。呢個就係主要係一個內疚啊、罪惡咁嘅來源啦，super ego。咁個 ego 咧就係 mediates between super ego 同埋 ID，去 try to satisfy both while maintaining reality contact。咁 mental health problems arise when there is imbalance between these forces，就係當呢3個 force 有唔平衡咧，咁就會引致一啲心理健康問題。咁之後就係講 defense mechanism。人嘅心理就分為有 六個方式去有6個嘅 defense mechanism 嘅。第一就係 repression 啦，pushing threatening thoughts into the unconscious 啦。第二就係 denial 啦，refusing to acknowledge an unacceptable reality。咁第三就係 projection 啦，attributing one's own unacceptable feeling to others。咁仲有 rationalization 啦，creating logical explanation for irrational behavior。咁仲有呢個 sublimation 啦，redirecting primitive impulses into socially acceptable activities 啦。咁仲有 displacement 啦，shifting emotion from the original source to a safer target。咁呢個 sublimation 咧，簡而言講就係將自己所有嗰啲即係唔被社會認可嘅慾望咧，去發泄去啲社會接受到嘅活動。就例如可能a patient with aggressive impulses channels energy into competitive sports，即係佢有一啲好 aggressive 嘅 impulse，佢就會將呢啲能量去全部擺晒去一啲競技性嘅運動度。咁仲有呢個 4P model 同埋呢個 4D model 啦。咁 4P model 就有4個 components 啦。第一就係 predisposing 啦，predisposing 就係一啲 long-term vulnerabilities that increase risk， 就係包括 chronic poverty 啦，仲有呢個 genetic predisposition， 咁仲有呢個 precipitating 啦，immediate stressor that trigger symptom onset， 就係例如一個突然之間冇咗份工。咁仲有呢個 perpetuating 就係 elements that maintain or worsen the situation，stigma 或者 ongoing family conflict。咁仲有呢個 protective 啦，resources that buffer stress and promote recovery。For example support network 啦，仲有呢個 coping skills。咁去 identify 到呢啲 factor 咧，就可以幫助到我哋嘅 personalized treatment、prevention 同埋 strength-based 嘅 intervention。咁仲有呢個 4D model 啦，第一就係 deviance 啦，behavior， 等等 4D model，behavior thoughts or emotions that differ markedly from culture or statistical norms。咁就係 pathologizing eccentricity, tailored care, assess cultural context。咁仲有呢個 distress 啦，subjective suffering experienced by individual, explore personal meaning of distress。Lack of distress may occur in some disorder， 即係有啲疾病，有啲心理疾病係會令到佢有一個 lack of distress 嘅。咁仲有呢個 dysfunction 啦，impairment in daily roles。咁就 nursing 就要 observe objective functional decline，document impact on life activities。咁仲有呢個 danger 啦，就需要一個 immediate actions。咁就係一啲 behavior that poses risk or harm to self or others。咁我哋就要 prioritize safety assessment 啦，implement crisis intervention and legal safeguards。咁 4D 就 determine the needs for diagnosis and interventions。咁大約就係咁多呢課，咁之後就係下一課啦，就 model concepts of health。咁首先就係 health， 就係一個 multi-dimensional concept that guides 4 elements。咁呢4個 elements 係 assessment， 就係 identifying patient needs beyond physical symptoms 啦。咁仲有呢個 intervention planning 啦，chooses care approaches aligned with patient's value。咁仲有呢個 outcome evaluation 啦，measure success in terms meaningful to the individual。咁仲有 policy influence 啦，shapes organization of health systems and resource allocation。咁 historical perspectives of health 就係唔一樣嘅，咁就分為咁就講翻啲歷史啦，就 define punishment and healing 啦。 illness as a punishment, recovery is a gift from God。咁 illness 就係一個懲罰啦，康復就係一個上帝嘅祝福啦。咁就有 Hippocratic balance 啦，health 就等於 balance of the four humours，blood、Belgium、black bile 仲有 black 仲有 yellow bile。咁 mind body connection 啦，咁呢個古希臘就 emphasize 呢個harmony between mental and physical health。咁 early definition of health 咧，health 就係 absence of overt diseases，就係冇明顯見到嘅疾病啦，就算係健康。咁之後就講到呢個 biomedical model 啦。咁 health 就等於 absence of disease、disability and pain。咁 treatment 就係 pharmaceuticals、surgery and other procedures aim to eliminate disease。咁佢個好處就係 effective in acute care，短期嘅 care 就好有效啦。drive scientific advancement 啦，就主要推動咗呢個科學嘅進步啦。clear focus on disease mechanism 啦，咁就好有一個好清楚嘅 focus 去 disease mechanism。咁個壞處就係 ignore social、psychological and environmental factors。咁 patient role 係 passive，就係佢就冇睇佢就唔係全人護理啦，即係佢 ignore 咗 social、psychological 仲有 environmental factors， 同埋病人喺醫療入邊係被動嘅。咁之後就講到呢個 WHO definition 啦，仲有 critiques 啦。咁 health 就等於 state of complete physical, mental and social well-being and not merely absence of disease or infirmity。咁佢主要就係 shift from what health is not 啦 to what health is。咁個 critiques 就係個批評就係 idealism。咁 complete well-being is rarely attainable, classifies most people as unhealthy。咁 static view 啦，implies health is a fixed state, ignoring its dynamic nature。仲有 medicalization 啦，risk of pathologizing normal emotions。醫藥化啦，即係推動一啲本身唔係疾病嘅疾病去變成疾病啦。咁仲有 measurement challenges, difficult to operationalize in practice and policy。咁之後就講到一個 positive health 啦，six dimension by 呢個 Harbour 2015。咁第一就係 bodily functions 啦，physical capacity、energy levels、functional abilities，就包括 physical capacity、energy levels、functional abilities。咁第二就係 mental functions 啦，perceptions 啦，就係包括 cognitive abilities、emotional regulation and psychological well-being。咁仲有呢個 spiritual、existential meaning 啦，就包括 meaning、purpose、values、connections to something better。第四就係 quality of life 啦，overall satisfaction 啦，happiness 啦 and contentment。咁仲有呢個 social and societal participation 啦，就包括 relationship 啊，community involvement、meaningful social roles。咁仲有 daily functioning 啦，ability to perform activities of daily living and maintain independence。咁 focus on capabilities and resilience rather than deficits。咁 contemporary dynamic and holistic view 就包括beyond fixed states 啊，health is a resource of living 啊，emphasizing adaptation and living 啊，就health 唔係一個固定嘅形態嘅，佢係即係人係唔可能永遠即係完美嘅，咁就所以就 emphasize 呢個 adaptation and living 啊。咁仲有呢個 multi-dimensionality 就包括 spiritual 啦、environmental 啦、psychological 啦、social 啦，仲有 personal factor， 全部都會 influence 到一個健康嘅 well-being 嘅。咁就仲有 health continuum， 就係 illness and wellness exists on a fluid spectrum rather than a binary classification，即係等於 dynamic 啦。咁 modern meanings of health in 呢個 mental health nursing 咧就係individualized and subjective。咁health experience varies from person to person 啦，所有人體驗到嘅 health 都係唔一樣嘅。咁仲有呢個 resilience and adaptation 啦，capacity to cope、recover and grow despite adversity，即係唔理任何嘅困難啦、阻礙啦，都有機會去康復、去成長。咁仲有呢個 recovery oriented 啦，emphasize living meaningful lives even with ongoing conditions，即使病都會着重於去有一個好有意義嘅生活啦。咁仲有呢個 social determinants 啊，socio-economic、cultural and environmental factors shape mental health。咁仲有呢個 interconnectedness 啊，physical、mental、social and spiritual health are inseparable。即係簡單嚟講，佢哋社會經濟文化同埋環境嘅因素都會影響到呢個心理健康嘅。咁仲有 interconnectedness 啊，咁包括生理上啦、物理上啦、生理上啦、心理上啦、社會上啦，仲有心靈上嘅健康係全部關聯嘅。咁就講到呢個 health beliefs and behaviour 啦。health beliefs 就係一啲 perception、altitudes and convictions about health shaped by personal, cultural and social influences。就簡單嚟講 ，health beliefs 就係我哋嗰個perception，即係我哋個想法就想法啦、態度啦，同埋一啲固有印象啦，去關於健康嘅就shaped by 呢個個人啦、文化上啦，同埋社會上嘅影響。咁 health behaviours actions taken to maintain, promote or restore health 啦，即係一啲動作啦，個目標就係去保持健康啦，去令到自己更健康啦，或者令到自己健康翻，就包括medication adherence 啊、exercise 啊、avoiding harmful substance，包括呢個即係同醫療嘅合作啦、運動啦，同埋唔食煙唔飲酒呢啲啊。咁個關係就係 belief 影響到 behaviour 嘅，即係個理念直接影響到自己嘅行為。咁 beliefs directly influence health actions, crucial for mental health nurses to assess。咁我哋身為一個 mental health nurse 就應該知道呢個 belief 係直接影響 behaviour 嘅。咁所以我哋要 assess 咗佢哋個 belief 先，睇下佢哋個 belief 點樣影響佢哋個 behaviour。咁就有幾個 model 啦，第一就係 ABC model 啦，framework to explain how events trigger beliefs that generate consequence。佢係一個 framework 嘅，去 explain 嗰啲所有嘅事件係點樣發生。咁就有3個元素啦，第一就係 activating event 啦，triggering situation 啦，簡單嚟講可以理解成一個導火索啦，去 trigger 直接將一樣嘢發生。咁第二就係呢個 belief system 啦，interpretation of the event determines the outcomes。咁第三就係呢個 consequence 啦，resulting behaviour or emotional response。呢個就係一個對當時事件嘅一個理解啦，就去決定個最後個出處、最後個後果。咁 consequence 就係個 behaviour or emotional response。咁之後就係呢個 HBM，就係呢個 health belief model。咁第一就分為幾個 construct 啦。第一就係 perceived susceptibility， 即係 belief about personal risk 啦。咁第二就係 perceived severity，就係 belief about seriousness of condition 啦。第三就係 perceived benefits 啦，belief in effectiveness of action 啦。第四就係呢個 perceived barriers 啦，obstacles to taking action 啦。仲有呢個 self-efficacy，confidence in ability to act。咁仲有呢個 clues to action 啦，triggers prompting behaviour stimuli。簡嚟講，呢個就係佢哋對自己嘅佢哋覺得嘅即係有咩風險啦。咁佢哋覺得個疾病有幾嚴重啦。佢哋覺得如果去尋找醫療幫助有咩功用啦，仲有咩困難去阻止佢哋去尋找幫助啦。self-efficacy 就係佢哋個自信啦。Clues to action 就係當時嗰個 trigger 嗰個 stimuli。個總結就係，如果 perceived benefits outweigh perceived barriers and self-efficacy is high, the patient is more likely to adhere to medication and experience better treatment outcome。即係簡嚟講就係呢個佢哋覺得個好處就大過佢哋覺得嘅難處，同埋佢哋個自信係高嗰陣時咧，咁個病人就會大機率去遵守呢個，即係去遵從醫院嘅安排啦，同埋佢哋個 treatment 都會好啲。咁仲有呢個 TBP 咧，Theory of Planned Behaviour 啦。咁個 core principle 就係 behavioral intervention is the strongest predictor of actual behaviour. Attitude toward the behaviour, positive or negative evaluation of performing the behaviour。咁個 subjective norms, perceived social pressure to perform or not perform the behaviour， 仲有 perceived behaviour control, belief in one's ability to execute the behaviour, similar to self-efficacy。咁聽落去 TBP 同埋HBM 都好似啦，但係其實佢哋都有啲唔一樣嘅。咁首先佢哋個 focus 咧，HBM 就 focus 喺 perceived health threat 啦，TBP 就係 focus 喺佢哋個行為，佢哋有咩動機，背後嗰個動機。咁個 primary construct 咧，HBM 就分為 suspectability 啊、severity 啊、benefits 啊、barriers 啊、self-efficacy 啊，同埋 clues to action 嘅。咁TBP 就分為 attitude 啦、subjective norms 啦、perceived control 啦。咁佢哋個 trigger 都唔一樣嘅，佢哋個導火索都唔一樣嘅。第一HBM 就係 clues to action 啦，TBP 就係佢哋個 intentional decision making，即係佢哋個決定，佢哋個抉擇。咁HBM 個 social influence 係 implicit fear barriers and clues，即係呢個社會影響就會喺呢個困難上面同埋 clue 上面體現到。咁TBP 就係體現喺呢個 subjective norms 度嘅。咁 best fit 咧，HBM 就最適用於呢個 preventive screening 啦，仲有呢個 disease specific actions 啊。咁 TBP 就最適用於 lifestyle changes 啊，broad health related behaviours。咁 health belief models 都有少少 critique 嘅。咁第一就係包括 overemphasis on rational decision making 啦，underestimate emotions。咁可能有啲行為，有啲行為係情緒上引致嘅，而唔係即係咁理智上面嘅決定咯。咁仲有呢個 limited cultural sensitivity 啊。咁好多嘅 model 都係 originate from the West，即係根據西方去發展，而唔係即係 ignore 咗其他地方嘅人。咁仲有 neglect of automatic behaviours，咁有啲可能係自動嘅行為啦。咁 fail to capture evolving beliefs 啊，就冇 capture 到一個進化緊嘅信念嘅。咁仲有 measurement relies heavily on self-report 啦。 咁之後就係 factors influencing health behaviours 啦，第一就係 social economic 啊，即係 income 啦、education 啦、employment 啦、access to services。咁仲有呢個 cultural 啦，belief about illness 啦、traditional healing 啦，仲有 stigma 啦，咁仲有呢個 social support 啦、family、friends、community networks 啊，仲有呢個 personal experience 啊、post healthcare interactions、treatment outcomes。咁仲有 mental health impact 啊、stigma、self-efficacy、adherence，仲有 patterns。咁stigma 就係佢哋一啲唔好嘅印象，就會 delay help seeking、reduce adherence、increases isolation、nursing intervention， 就影響咗 nursing intervention、education、challenge nursing interventions 就包括 education 啦、challenge self stigma 啦、normalize dialogue 啦、recovery narratives 啦，咁之後仲有呢個 clinical implication 啦。咁我哋就 assess 呢個 individual beliefs 啦，tailor care to each patient's health worldview，即係我哋要 provide 一個度身訂造嘅care 啦，去俾啲病人啦，根據佢哋嘅 health worldview。咁仲有 cultural competence 啦，recognize and respect diverse health paradigms。咁仲有 adapt interventions 啦，align treatments with existing beliefs where possible. Use culturally congruent education. Involve family community. When appropriate, integrate support networks into health care plans. 咁仲有呢個 safety and evidence balance 啊，respect traditional practice while ensuring safety and evidence-based care。咁之後就講到呢個 Maslow hierarchy of needs。咁psychological and nutrition 啊，hydration 啦，sleep hygiene 啦，同埋 hygiene 啦。咁safety and security 就 provide stable environment 啦，prevent harm 啦，medication safety 啦。咁仲有呢個 love and belonging，就會 foster 呢個 therapeutic relationship，encourage peer support，involve family。咁仲有呢個 self-esteem 啦，promote autonomy，recognize achievement，仲有 set attainable goals。咁仲有呢個 self-actualization，support personal growth，meaning making，creative expression，pursuit of passions。咁呢度就係大約咁多即係所有嘅我 miss 咗嘅 lecture notes 就到此為止。